Hello everyone. Welcome to today's live. Today I am going to speak on one very practical topic, and the topic is how to prepare for ImmuLIT procedure and what patients should know about preparation for ImmuLIT procedure. I am Dr. Mohan Raut. I am a practicing gynecologist and clinical reproductive immunologist. We have our centers, Dr. Raut Centers for Reproductive Immunology in Mumbai and also in 5 other parts of India, and that is Pune, Nagpur, Delhi, Bangalore, and Hyderabad. And at these centers, we treat couples with repeated miscarriages, recurrent IVF failures, and unexplained infertility with our special patented branded process, as you all know, ImmuLIT, which is a type of lymphocyte immunization therapy followed by certain immunomodulatory medicines. So, coming to today's topic and what a patient should know about preparing for ImmuLIT. Now, ImmuLIT, as you know, is an active immunomodulatory treatment. It uses lymphocytes from husband or donor to produce immunomodulation in wife, and which helps in preventing repeated miscarriages, unexplained IVF failures or implantation failures, and unexplained infertility, where the underlying problem is alloimmune rejection of pregnancy. Now, coming to the first part, that is in which cases to be prepared for LIT. First, we must know in which cases it is going to be useful for me. The patient must know whether it is going to be useful for me. So, as I said, if the patient has unexplained repeated miscarriages, all reports are normal, or unexplained IVF failure or implantation failure, there is no otherwise cause found, or unexplained infertility, then it is highly likely that these problems are because of the alloimmune problem in that particular couple. So, how do you? It is important for patient to know that how is the selection done for the procedure. So that is by doing certain tests, which we have always mentioned in our previous videos also, that the lymphocyte cross match, if it is negative, NK cells showing changes in the natural killer cell activity, increased inflammatory cytokine TNF alpha, and raised antithyroid antibodies. Now, if these indicate, then the couple is selected for the ImmuLIT treatment. But what is the important prerequisite now? It is very important that the patient should have both the husband and wife both should have their infection profile done, and the infection profile has to be also done not by spot method but by the quantitative method, that is ELISA, ECLI, etc. Because whenever a part of the blood component is taken out from one person and injected into other, it is important to have these particular methods of infection profile. So after the prerequisites, what is the actual preparation? Many times patients ask, what is required to be done? Is it a surgery? Does it require anesthesia, or do we have to hospitalize? So lymphocyte immunization therapy or ImmuLIT is a daycare procedure. It doesn't require hospitalization, or it's not a surgery. So there is no special preparation is required. Once the test and all prerequisites are met with, then the preparation practically includes a few things. The timing of the procedure is not related to menstrual cycle of the woman. So it can be done any time of the menstrual cycle. So couple can select any date that is suitable for you. Then before the day of ImmuLIT procedure, the previous day, it is advisable to, or rather it is required to avoid alcohol ingestion, very important, and even smoking the previous night. Then on the day of ImmuLIT procedure, the couple can have sumptuous breakfast. They must have breakfast before coming. Fasting is not required, and they come with all their reports and files. At the center, after the initial registration and formalities are done, then the couple is prepared for the immunomodulatory procedure or ImmuLIT procedure. And here the preparation that is done is so that the couple is explained about the procedure, what will be done, and then that is followed by the procedure. The procedure involves collection of blood from the husband. So it is explained to them that this blood will be collected from both the sides and both the arms, and this blood is then immediately processed and for separation of lymphocytes, and the procedure goes on. And after the collection of blood and processing of the cells that is done, then the couple is asked to the cells which are separated are injected in wife, and these cells then later on lead to immunomodulatory procedure. Now here, before the procedure, one more important thing is both husband and wife should be in good health. If there is any medical illness, in the sense if the patient or husband has fever or some other infection, then the procedure cannot be done. Then the procedure has to be postponed. And once the couple comes for the treatment, the entire treatment gets over within almost like 3 hours, and the couple is not hospitalized, and after the procedure they can immediately go back and resume their day-to-day activities. So therefore they don't require special preparation for coming to the ImmuLIT procedure. And after ImmuLIT procedure also, they don't require rest, they don't require to wait at the hospital or get hospitalized, admitted for that matter, and they can immediately go, even can travel. They can travel outstation also by either even flight is not a problem. So many a times couples fly in the morning, get the treatment done, and go back in the evening. So one more thing related to the preparation is the injections of ImmuLIT are given on the skin where there are no tattoos or no mehendi. So it is important that it is better to avoid the areas where there is tattoo or mehendi, but the couple preferably should not, or the wife preferably should not put mehendi in the immediately a few days prior to the planned ImmuLIT procedure. So these are some of the practical points how the couple can prepare for an ImmuLIT procedure. So you must have gathered from this why I have talked on this subject, because this is very often asked to us, and asked to us what preparation is required. And as you have seen now, that it doesn't require something special before the procedure as well as after the procedure. The most important part is the special part is the procedure itself. So if once this is known to the couple, how they can prepare for it, the anxiety goes away, because the couple is very anxious when they come for this treatment. So therefore, if once they know what is expected of them or what they expect from the doctor, then it becomes a stress-free procedure, and the fear goes away, fear of pain or fear of any other imaginary things which the couple may think of. So therefore, the procedure can be easily planned, and as I said, doesn't require lot of preparation. And if you have any doubts about the ImmuLIT procedure, you can always call us on our number, that is 9833201522. For more information, you can even contact our website, that is www.icprm.in. And if you want us to talk on a specific aspect of ImmuLIT procedure, do write to us so that in our live we can cover that specific topic. Like today I mentioned about the procedures, about the preparation for ImmuLIT procedure, because today after performing the today's ImmuLIT list of almost I think 9 or 10 patients, we realized that this question has been asked very often, and how we should prepare and what can go wrong. So all those things, if the couple is explained beforehand, if they listen to this video, then it will be easy for them to be ready for the procedure without any stress. So thank you so much. And See you again on in next week in our live presentation. Thank you